Today's video is about borderline personality disorder, or BPD. This was a highly requested video from your comments on TikTok and from your messages on Instagram. It's very likely that I will make many more videos about this topic as there is so much information to cover all at once. But in this video, I will cover what BPD is, the symptoms, and the type of therapy that helps. But first, if you're new to my channel, welcome. I am so happy that you are here. My name is Micheline Maalouf, and I'm a licensed therapist. I make videos once a week about mental health topics that you send me across social media platforms. So if you have a question, send it my way, and be sure to hit the subscribe button and turn your notifications on so that you never miss an update. Now let's get started. So BPD is known mostly for causing significant difficulties regulating emotions. So people who are diagnosed with BPD may feel emotions intensely and for long periods of time. So this means that when somebody with BPD gets triggered, the emotions that they experience are very intense. They are long-lasting, and it can be much more difficult for them to get back to the baseline stability afterwards. Because of these feelings, people with BPD also suffer with low self-esteem, poor self-image, and unstable relationships that are constantly going back and forth, going from completely idealizing relationships to getting really angry and upset and completely disowning and cutting people out. Because BPD causes such intense emotions, many people with BPD struggle with self-harm in order to release these intense feelings that they're experiencing, or to feel something when they're feeling some of the numbness symptoms of this disorder. Now, I'm going to cover the symptoms of BPD as they come directly from the DSM, which is the Diagnostic Manual for Mental Health Professionals. Keep in mind, this is not the only way we diagnose BPD. It is one of the tools that we use. If someone may meet the criteria, we will take a look at these symptoms. But it's very important to note that many of you will find yourselves thinking, I have some of these symptoms, and that's normal. A lot of us have experienced some of these symptoms throughout our lives as they are part of personality, they are part of who we are. So keep in mind, there are many factors that are considered before a professional makes a diagnosis. So very important not to self-diagnose. Instead, if you feel that you might have BPD, then please see a mental health professional. Let them know what you're experiencing, and they can help you come to a proper diagnosis and treatment. I will talk about what kind of therapist and what kind of therapy is more helpful for somebody who has borderline personality disorder, so stay tuned to the end of this video for that. Now, let's talk about the symptoms. The first symptom is a frantic effort to avoid real or imagined abandonment. So this means that you have a difficult time trusting that the people you care about won't leave you or abandon you, and you will go out of your way and constantly check and participate in behaviors to ensure that the person does not leave you. The second symptom is unstable personal relationships that move from idealization, so I love you so much, to devaluation, I can't stand you. The third symptom is unstable self-image, which can lead to instability of opinions, moods, values, and goals. So you might find yourself constantly moving from seeing things one way to completely changing your mind and your views. So this can cause you and those around you to feel confused. The fourth symptom is impulsive behaviors, such as spending a lot of money, substance abuse, deciding to quit your job out of nowhere, unsafe sex, and other behaviors that can have negative long-term consequences or outcomes and can be dangerous to your life. The fifth symptom is self-harming behavior. So this could include suicide attempts and cutting. So many times this is done to either release some of the pain that you're experiencing or to numb the pain. And sometimes it's even to get the attention of other people, hence the lack of abandonment, because they will freak out for you and then they're less likely to abandon you. The sixth symptom is periods of intense depressed mood, irritability, or anxiety that can last for a few hours to a few days, and you might find yourself suddenly feeling sad or anxious, and you might not know why, not able to pinpoint what's happening that caused you to feel that way. The seventh symptom is chronic feelings of emptiness or boredom. So emptiness and lack of joy in life is a common symptom, and it can be related to the depression that is present in this disorder. The eighth symptom is intense anger or uncontrollable anger, which is then followed by feelings of shame and guilt. So if someone does something to make you upset, you might get extremely angry. And sometimes we call this inappropriate anger because it often goes beyond the response that is merited for that situation. And the final symptom is feelings of dissociation, which means disconnecting from your thoughts or sense of identity. I have actually created a video about dissociation in the past, and I will link it up here so that you can learn more about dissociation and how to ground yourself when it does happen to you. So although it's not really known what causes BPD, it's thought to be a combination of things. So things including genetics, environmental factors such as experiencing a trauma early on in life, and brain function. And although BPD gets a really bad reputation in the mental health world, it is treatable, and you can live a happy and fulfilling life despite having this diagnosis. The things that can help include regularly attending therapy, especially dialectical behavioral therapy or DBT, and medication such as mood stabilizers and antidepressants. So DBT therapy is extremely helpful because it teaches you to cope with the emotions, it helps you learn to regulate the instability, and it teaches you new coping skills such as grounding skills and mindfulness and meditation. So if you feel that you have BPD, you can visit a therapist directory site such as www.psychologytoday.com, which I will link in the description below. That way you can look for a therapist who specializes in DBT and borderline personality disorder. Keep in mind that not all therapy is made the same. So DBT is known to be the gold standard for borderline personality disorder. So that is the type of therapy you should be looking for. There's also a great workbook that I use with my clients, and it's called the DBT Skills Workbook. And I have linked it in the description below. It links directly to my Amazon page where I have my favorite workbooks. So click on it and look for the green book that's called, again, the DBT or Dialectical Behavioral Skills Workbook. And you can get started working on some of these tools and skills at home today. I really hope that you found this video helpful, and please talk to me in the comments. What else do you want to know about borderline personality disorder? Have you experienced some of these symptoms? Have you been to therapy, and what has helped you? I would love to start a chat, and I'll see you guys next time.